So a dental crown is a restoration that goes all around the tooth. It's made out of a highly strong ceramic material, and because it goes all around the tooth, it stabilizes the tooth structure. A dental crown is usually done if the tooth is very structurally compromised. So before doing this kind of treatment, there's usually either a big cavity or very large fillings that were not stable enough for the tooth, so there's small cracks in the teeth. And to solve this, and if you want to make the tooth stable again, you create a restoration that goes all around the tooth, which is called a dental crown. So to create the crown, we do a 3D scan of the treated tooth and the teeth around it. And then everything goes into a special software, and the computer automatically, using AI, analyzes the teeth surrounding the one that's being treated and also the opposing jaw, and automatically calculates the tooth that is missing here and creates this restoration for us. Dental crown is a restoration that is being done for a very long period of time, and it has to work really well to achieve this. So it's something technologically that's very complicated to achieve, because it's such a high standard that's behind it. And that's why in the past, this would have needed multiple appointments. In the first appointment, you would have prepared the tooth, take an impression, put the provisional on the patient, then send everything to the laboratory where they create the crown. And after about 2 weeks, you would get the final restoration. Today at our office, we have a lot of technology that we use here on site. And because of that, we're able to produce a dental crown out of a very, very strong material, zirconia ceramic, in an entire time of about 1.5 hours. Of course, everybody wants everything to last for a lifetime. However, you have to be realistic and really open about it. Nothing will last forever. So whatever you do, there might be some problems. If you look at the survival rate of dental crowns, and it's also a treatment that's been done for a long time now, the data is really good. And today, compared to the past, also technologically, we have a lot of improvements. So in the past, the problems that were the most common was that a part of the crown simply broke off or fell off, which is called chipping. And the reason for that is that you needed something on the inside of the crown for the strength, which was a metal. And since you don't want to see the metal, you put a very soft ceramic on the outside to make the tooth look like a normal natural tooth. This material is the one that usually broke, and it had a strength, just to give you an idea, of about 120 megapascal. Today, we are able to use materials like zirconia ceramics that have a strength of between 1,100 and 1,200 megapascals. So it's 10 times stronger, and the materials today are also that good looking that you can create the entire crown out of this material, out of a single block. So it's really, you can say, unlikely that you will encounter technological problems there. My name is Sebastian Horvath. I'm a dentist and certified qualified specialist for prosthodontics. I love being a dentist because it's a great combination of doing something medically, which has a big impact on our patients, and also doing something with your hands. I also give courses for other dentists, and I wanted to create a slide in which I, try to tell them that when you do something new, you should focus on stuff that really brings you forward, like a rocket. And, I created this slide, and I loved it so much that today our office is full of rockets.